Travel medicine is all about preparing a patient and a family for international travel. So we take the approach of looking at each individual itinerary that a family may have and looking at all the different points within that travel itinerary where there could be risk for infection or injury. And then we spend the visit talking about ways to prevent injury and illness and providing any medication, vaccination, or any counseling or education that can keep a patient and their family healthy so that they can enjoy their trip. In Travel Clinic, we provide comprehensive travel medicine care. So that includes a personalized care plan for anybody who has underlying medical issues, just so that they can be prepared in case they were to get sick when they travel. That can be very different for a young child, an adolescent, or an adult. So we really focus on the age of the patient and any underlying medical conditions so that we can prepare them as much as possible. Within our travel clinic, a big part of our emphasis is on education, really learning everything that you need to know so that you can have healthy practices during your trip so that you can stay healthy both during and after your travel. If we find that you're traveling somewhere that you need a special vaccine, we'll provide that vaccine to you within the travel medicine clinic. And any vaccines or any other documentation that you'll need for your trip to cross international boundaries, we'll provide that for you as well. So when you're traveling abroad, we think it's a good idea to notify our travel clinic as soon as you know that you're traveling. The reason for that is that certain vaccines you'll need to get several of before you travel, and that can take several weeks to months before you travel. So as soon as you know, you can give us a call, and then we'll help you determine when the optimal time is for you to see us before your travel. When you're traveling internationally, you need vaccinations for just about every destination. The exceptions to that are Western European countries such as Italy, France, Spain, places that have very similar hygiene practices as the United States. Also, when you're traveling to Canada, you generally would not need vaccination. However, most other places, you should at least consider certain high-impact vaccines for your trip. In our travel medicine clinic, vaccination can be very important. And we all know that it's very difficult to keep track of what vaccines that you've received and why you received them. When you leave our travel medicine clinic, we provide a travel vaccine card that will be for every person in the family that's traveling. And we just like to give specific information about which vaccine you received and the date and that you received it in our clinic so that you can keep track of it for future travel. You actually don't need a physician referral to come to our travel clinic. People can self-refer, and you would simply call our clinic phone number and ask for a travel medicine visit. There you'll get your information collected and you'll provide some information about your itinerary, and then we'll contact you back and we'll help you to schedule that appointment at the right time. Rosie Olivero, Section Chief of Pediatric Infectious Diseases, Spectrum Health at Helen DeVos Children's Hospital.